Okay, so what we're going to do here today is a demonstration on how to do a one-handed and a two-handed instrument transfer using a restorative tray. So the first thing the dentist is going to want to do is examine the area that they're going to restore. So you should always have your mirror and your Explorer ready as the first instruments that you'll be passing. When you pass that mirror and Explorer, you will be passing them both at the same time. This is a right-handed dentist, so you're sitting on the patient's left-hand side chair in your dental assisting chair. You can see here Karen is about 4 to 6 inches taller than the dentist, okay? So you should be up a little bit higher than the dentist sitting in your dental assisting chair with your lumbar bar in front of you, so you're securely seated on your dental assisting stool. So Karen now has ready her mirror and Explorer that she's going to pass to the dentist, so the dentist can examine the area we're going to be working on. She's going to have the mirror in her right hand and the instrument, the Explorer, in her left hand, ready to pass the dentist. So when it goes to the dentist, they're going to have the actual working instrument, which is the Explorer, in their dominant hand. And since she's right-handed, she will have the Explorer placed in her right hand and the mirror in her left hand, all at the same time. So this is a demonstration of passing the mirror and Explorer to the dentist. Go. Karen's passing that in the transfer zone. The dentist's hands are waiting in the transfer zone. The dental assistant needs to go to the dentist, not the dentist coming to the dental assistant to grab the instruments. So Sylvie, as the dentist, you can see, is retracting the cheek with her mirror, the face of the mirror. She is fulcruming, and she's holding her instrument in a pen grasp, exploring that area. So the dentist is exploring that area, and then we're going to fast forward to having the hand pieces, the rotary instruments, already having cut the prep. And so the next step after cutting the prep would be to use some hand instruments. The dentist looks and decides they will need a spoon excavator to remove some soft decay. So Karen will have the spoon excavator ready in the transfer zone. Okay, the instrument should be parallel to the instrument she's taking. She's going to pass it, place it, and then to retrieve it back, she's going to do it again. Pass, place, and now the important thing for safety is rolling the handle and tucking the index finger under the instrument. Okay, that was the spoon excavator. Next we'll use a mesial margin trimmer. Mesial margin trimmer. Same thing, have the instrument parallel, ready to be taken while the dentist is working. Grab the instrument, place it in the hand of the dentist, pull the instrument up. Should have showed them in the video. Hold it up, roll, and tuck. Okay, and now the distal margin trimmer will do the same thing. Have it ready in the transfer zone. Dentist is going to signal completion by dropping the handle. Grab the handle, place it in between the fingers. Bring that instrument, roll with your thumb up your fingers, and tuck your index finger underneath. We do not want to go over the tip of the instrument because that may cause you to poke yourself and possibly puncture your gloves and cross-contaminate into your finger. So you want to pass safely by rolling and tucking underneath that handle. The dentist now will be ready to fill the tooth. And so now we're going to change it up to a two-handed transfer by using the amalgam carrier and the plugger that's going to go back and forth until the actual prep is filled with amalgam. So we have the amalgam carrier ready. She's going to place it into the dentist's hand, okay, nice and firmly, and then have the plugger or the condenser ready. This is a two-handed transfer. Take with your left, pass with your right. Fill it again. You're going to hold the amalgam carrier in your right hand and be ready with your left hand to retrieve the plugger. Put it in the dentist's hand. Hold that. And this is going to happen 3 or 4 times. Okay. Now, when you are passing, make sure you're passing so the dentist, where they're grabbing, is not inhibited by your hand. So you need to be away from the dentist's hand. So when you're passing this plugger, okay, you need to be passing it here, up here, okay, and pass it to the dentist so they can grab it down below, okay? So this is the end. We're working on the mandible, so that tip is pointing down, and it's like a circle. It's coming around in a circle. And we'll do that one more time. And the dentist then will signal whether or not they need another mix of amalgam or whether that is enough. And I believe that that's enough. So one more time with the plugger. And now be ready for the discoid cleoid carver, because now we're going to carve the amalgam. Back to one-handed transfer now. Discoid cleoid, and then the Clapeyson will be next. Sorry, my fingers. That's okay. And then the ward. And then the Hollenbach. Hollenbach half will be next. Interproximal. And the ball burnisher. And once it's burnished, the dentist may ask for a cotton roll, and you'll pass that with your cotton pliers, and that will also now be two-handed. So we hold on to this by the area where it's locked into place. Take with your left, pass with your right. And then the articulating paper to check the bite. Two-handed, take with your right. Okay. And now the dentist may need another carver if the bite is the filling material is too high to remove excess material. And then they'll check one more time. And the carver, maybe or maybe not.
No, it's all good.
It's all good. So when they say it's all good, maybe another cotton roll with some wetness on it so that we can take the articulating paper spots off of the filling. It's all nice and clean. And then the post instructions for your patient at this point would be to recognize that, number one, they're still frozen. So be careful how they're biting or chewing. Try to stay away from that side for the next 24 hours before it reaches maximum hardness, right? And if it feels really different or feels still high, after a couple of days, to call the office to come in and they can recheck the bite and maybe need to take it down a little bit more. But the most important things about after this is finished is that they're not biting their lip or their cheek because they're frozen still, okay? And they'll still feel frozen after after they've left, and that they should probably chew on the opposite side of the mouth just until the next day, okay? And then after that, they should be able to chew normally on that side without any discomfort and without any pain whatsoever. And if they are feeling anything, they need to call the office to come in and have the dentist have a look at that, okay? And then we would chart that in the chart exactly what we did. So we did a 4-6, which is identifying the tooth number. The surfaces we did, if we did an MOD, okay? And if we did an MOD, we put it down as an MOD, and the materials that we used in that particular area. And then what would be really important, of course, is once we've done the anesthetic, we'd put down the type of anesthetic and how many cartridges of anesthetic that we've also placed in there. So documentation is really important. Some dentists choose to document on their own, okay? And some dentists has their dental assistant document the procedures for them as well. Okay, so that's it.